Well, right now I want to welcome in Melanie Israel from the Daily Signal, dailysignal.com. Melanie is a research associate at the DeVos Center for Religion and Civil Society at the Heritage Foundation. Melanie, good afternoon.
Hi, good afternoon.
When somebody's facing budget cuts, I guess it's not a surprise to see them lash out or speak up. In this particular case, the president's budget would eliminate public monies for Planned Parenthood, and I'm from reading your article, I guess they're about to fight back.
Right. And this is going to play out most immediately as the discussions continue with repealing Obamacare through reconciliation. The 2015 bill had language that would cut off certain funding for Planned Parenthood. The language we've seen this time around has that same language, and so for them, this is becoming a very real possibility in a sense that we didn't really see back under the Obama administration.
Yeah, so I misspoke there. It's not the president's budget. It's actually the American Health Care Act that would remove funding for Planned Parenthood.
Right. That's the most immediate threat to Planned Parenthood's funding, and of course, the president has also committed to say that he does want Congress to ultimately defund Planned Parenthood permanently for good. But the immediate threat right now is in the Obamacare repeal process.
Oh, wow. So what are the numbers in terms of what they get? I remember reading something about this once before. It didn't strike me that it's any large percentage of the United States budget. This is more an issue of disagreeing with Planned Parenthood's operations in general, the fact that they provide abortions even if supposedly none of the federal money is allowed to be spent for that.
Sure. So essentially, Planned Parenthood gets $500 million every year from the federal government, and most of that comes in the form of Medicaid reimbursements, which is what the reconciliation bill is going after. But then they also get grants from other programs as well, but it's a pretty small percentage of their overall government funding compared to the Medicaid reimbursements, which, as you alluded to, those can't directly pay for most abortions. But money is fungible, so any money that Planned Parenthood is getting from the federal government is offsetting the cost elsewhere. So again, I just have to repeat this line all the time. Money is fungible, and it's not just the direct spending that people have a problem with. People have a problem with propping up the abortion industry.
Yeah, I heard Tom Price use that word the other day, and for people who aren't familiar with it, it just means that, if you've got a pot of money in your left hand, a pot of money in your right hand, you're not allowed to do certain things with the money in your left hand, but you can with the right hand. But it's still part of the budget, right? So you've got a total
of it's still part of the overall picture that you're looking at, and so that's why folks are trying to ensure that Planned Parenthood doesn't continue receiving this funding, and they are trying to fight back. They're starting this $1 million ad campaign to try to highlight services that make up not a very large part of what the organization is really about. They're definitely playing defense.
Yeah, you've got to hit those percentages for me because I want my listeners to hear this. So what they're going to try to highlight are things that are like cancer screenings and things like that Planned Parenthood provides. But then there's that when you say that's kind of a small percentage, go ahead and talk about some of the numbers you have in this article.
Sure. So Live Action has done great work highlighting this. Planned Parenthood does 0.97% of pap smears and 1.8% of breast exams in the U.S. Not mammograms. They do 0 mammograms. But breast exams, 1.8%. Pap smears, less than 1%. And at the same time, they perform a third of the abortions in the United States each year. And over the years, their cancer screening and prevention services have been dropping each year. Since 2010, those services, according to Planned Parenthood's own numbers, have decreased by 57%.
Yeah, the other number that caught my attention was from 2014-2015. The most recent annual report showed that 94% of Planned Parenthood's pregnancy resolution services were abortions, and that less than 1% were adoption referrals. Exactly. So, I mean, it's just worth pointing out when we talk about the fact that the money is fungible. It's easy to see that a very large percentage of what that organization deals with abortion, and a lot of people are convinced that even if we give you money and tell you can't use it for that, it's just replacing money you otherwise would have used for some other purpose and gives you more money for the other purpose. Correct?
Right, yeah. Right, and I think that even the overarching message is that Planned Parenthood is doing this new ad campaign to try to present itself as if it's not an abortion organization that's doing these procedures on an industrial scale in a very profit-driven manner.
Right.
But Planned Parenthood's own reports are telling us that in the last several years, contraceptive services have dropped. STD, STI prevention services dropped. Total services dropped. Total number of unique patients seen has dropped. And again, cancer screening and prevention services, that's dropped.
Mm-hmm.
And so it's very interesting that they're choosing to highlight services that have clearly not been making up a large portion of what they're doing each year.
Putting lipstick on a pig, but I mean, that's. Sorry, that's probably a bad analogy. So they spent $30 million in the 2016 election fighting against Donald Trump. I'm wondering how much they're going to spend on this fight. But if they've got $500 million a year coming in from taxpayers, they certainly have a little bit of money to spend. That's for sure.
Sure. And I do have to highlight, because I know it gets kind of confusing sometimes when we're talking about Planned Parenthood generally. It is two separate entities, so to speak, that we're talking about. You've got Planned Parenthood Federation for America. That's who's actually running the clinics. And they can't do electioneering. The election activity is done by Planned Parenthood Action. So
okay.
It's under the Planned Parenthood umbrella, so I don't want it to seem like we're saying Planned Parenthood is using tax dollars for election purposes.
Sure. Yeah, that's
not.
important. Yeah, good.
But Planned Parenthood, generally, when we're talking about Planned Parenthood, we're referring to both of those.
Well, I appreciate you joining us, Melanie Israel from the Daily Signal and the Heritage Foundation. People can go to dailysignal.com, and let me recommend that you do that and read Melanie's article on this new ad campaign that's about to be rolled out to defend Planned Parenthood. Melanie, have a great weekend.
Thanks, you too.
Yeah, thank you very much. Appreciate your time. All right.